What makes you the best candidate for this position? I would be the best candidate for this position because I am hardworking and work well in a team. I have a solution-focused work ethic and strive to always provide the best patient-centered care. I value my patients' safety and comfort over anything and will work towards creating an atmosphere where this can be implemented. What specific skills do you bring to our facility? I believe I will be bringing many valuable skills to this facility. I believe communication is highly important when working in a team. Communication will allow me to effectively distribute tasks to others as well as learn from my peers. It is important to know when to ask for clarification to make sure the team and I provide the best care for the residents. I am committed to providing you with flexible hours that will accommodate all shift requirements. Lastly, I possess the skills to build the residents' self-esteem and confidence as I encourage them to complete their activities of daily living and help to promote their independence within their physical or emotional capability. Tell me about a time when you had conflict with a coworker or teammate. What were the steps you took to resolve this? As a team member at my previous job, it was my responsibility to make sure all shift chores were completed at the appropriate time. I did have conflict with a student who left without completing their chores, so on the next shift I made sure they were aware of their chore schedule and had them sign in after they had completed their chore. I explained the importance of teamwork and how leaving their shift without completing their scheduled tasks made it more difficult for the night staff. We were able to come to an understanding to keep the store clean and accomplished with communication. What type of person do you have the most difficulty working with? What steps do you take to work with them in an effective and efficient manner? I have the most difficulty working with someone who has a poor work ethic and time management. You do not have to go above and beyond and do everyone's tasks or never sit down, but I do believe making sure you've maintained your workspace and strive to do your best so that anyone coming in after you has all the tools necessary to do their job. When working with a group of people, it is important to think about how to make everyone's job easier in a professional environment. As long as everyone's pitching in and doing what is required of them, I am a happy worker. If I do see someone who isn't pulling their weight and possibly letting others pick up the slack around them, then I would communicate to them that it is important to have pride in their work and ask them if they need any clarification on what their role requires of them, because they might not know what roles and responsibilities are involved with the job. An example of a time when I had to communicate complex information to someone in a simplified way and the strategies that I used while working at my placement as a student nurse, it was my responsibility to provide care to the elderly. One of my residents were extremely hard of hearing with mild cognitive impairments, and I had to provide instructions through touch, action, and speaking clearly and concisely so I was understood. This allowed me to provide proper cueing so that independence during their morning routine was accomplished. Tell me about a time when you had to deliver some news to someone that were reluctant to hear. At my placement, I was instructed to bathe one of my residents. Upon entering the room, the resident presented in a bad mood and was reluctant to get out of bed and start her day. She had refused a bed bath the previous day and then had to provide some health teaching on the importance of personal hygiene and convinced her that a warm shower would do her good and leave her feeling refreshed. I was able to encourage her through patience and understanding and explaining to her how necessary it was for care to be provided. If you have any questions about the position or the facility, you are welcome to ask them now. During the past months, how have your residents and staff dealt with COVID outbreaks? What does your facility do to accommodate visiting hours and exercise for the residents? And what can I do to advance in the facility that will help to better my residents' experience?